Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related most important question answer. Part 13. Let's start. The first question: in a 4.5 mm ET tube, what size of suction catheter is used? Option A 10 French, option B 12 French, option C 15 French, option D 18 French. The correct option is option A 10 French. A child is on CPAP and is hemodynamically stable. Which of the following is the best method of feeding this child? Option A breastfeeding, option B nasogastric feeding, option C calf feeding, option D IV fluids. The correct option is option B nasogastric feeding. In a 3-year-old child, which of the following is the best complementary feed that can be given to this child? Option A mashed banana, option B dal rice, option C fruit juice, option D boiled soft carrot. The correct option is option B dal rice. The trans-illumination procedure is done with option A venipuncture, option B angiography, option C blood culture, option D bone marrow aspiration. The correct option is option A venipuncture. During IV administration, which of the following drug causes extravasation and damage to site? Option A diazepam, option B epinephrine, option C phenytoin, option D ranitidine. The correct option is option C phenytoin. According to ABC, which of the following describes improper cardiac circulation? Option A hypotension, option B diminished pulse, option C tachypnea, option D CRT less than 3 seconds. The correct option is option B diminished pulse. Patient has temperature 103 degree Fahrenheit, HR 110 per minute, RR 23 per minute, BP 132/66 mmHg. Which factor you will primarily manage in this patient? Option A temperature 103 degree Fahrenheit, option B HR 110 per minute, option C RR 23 per minute, option D BP 132/66 mmHg. The correct option is option A temperature 103 degree Fahrenheit. Patient has vitals BP 120/66, pulse 88, SpO2 99, RR 23. This patient should be classified in which triage? Option A red, option B yellow, option C green, option D black. The correct option is option C green. The earliest sign of hypocalcemia is option A twitching, option B negative caustic sign, option C weakness, option D exaggerated DTRS. The correct option is option A twitching. The earliest symptom of hyponatremia is option A fatigue, option B ataxia, option C thirst, option D weakness. The correct option is option A fatigue. During suctioning, the patient complains of respiratory distress. First nursing action should be option A immediately remove suction catheter, option B suction rapidly in 5 seconds and remove the catheter, option C call senior nurse, option D call doctor immediately. The correct option is option A immediately remove suction catheter. Identify the abnormalities seen in this patient: pH 7.25, pCO2 40, ACO3 22, Na 150, Cl 100. Option A metabolic acidosis, Option B, respiratory acidosis. Option C, metabolic alkalosis. Option D, respiratory alkalosis. The correct option is option A, metabolic acidosis. A patient is having calcium level of 7 mg per day. Identify ECG changes seen in this patient. Option A, T wave inversion. Option B, prolonged QT interval. Option C, prominent T wave. Option D, peak U wave. The correct option is option B, prolonged QT interval. Complication of high flow of ventilation. Option A, aspiration. Option B, pneumothorax. Option C, diaphragmatic hernia. Option D, COPD. The correct option is option B, pneumothorax. While using a cardiotogram, the given fetal heart rate to uterine contraction relation shows the fetal heart rate gradually decreases and returns to baseline, but the nadir of deceleration occurs after the peak of each uterine contraction. Option A, early deceleration. Option B, late deceleration. Option C, variable deceleration. Option B, acceleration. The correct option is option B, late deceleration. Normal compression to ventilation ratio. Option A, 30:2. Option B, 15:2. Option C, 2:30. Option D, 15:1. The correct option is option A, 30:2. Which infection is most common in operation theatre? Option A, UTI. Option B, SSI. Option C, RTI. Option D, CNS infection. The correct option is option B, SSI. Color of biomedical waste bag for infectious waste. Option A, blue. Option B, red. Option C, yellow. Option D, black. The correct option is option C, yellow. Bodic test is used for option A, chemical sterilization. Option B, dry heat test. Option C, steam penetration test. Option D, UV sterilization. The correct option is option C, steam penetration test. Which lead is considered most important for rhythm monitoring? Option A, lead 1. Option B, lead 2. Option C, lead 3. Option D, AVL. The correct option is option B, lead 2. Which arrhythmia is life-threatening and requires immediate defibrillation? Option A, atrial flutter. Option B, ventricular fibrillation. Option C, sinus bradycardia. Option D, first degree AV block. The correct option is option B, ventricular fibrillation. If the blood pressure curve used is too short, what type of error will occur in BP measurement? Option A, blood pressure reading will be falsely low. Option B, blood pressure reading will be falsely high. Option C, blood pressure reading will be normal. Option D, no effect on blood pressure reading. The correct option is option B, blood pressure reading will be falsely high. Under the revised Integrated Child Development Service ICDS program, what is the recommended daily nutritional provision for children aged 6 to 72 months under the Supplementary Nutrition Program SNP Portion 2.0? Option A, 250 calories plus 8 to 10 gram protein. Option B, 500 calories plus 12 to 15 gram protein. Option C, 800 calories plus 15 to 18 gram protein. Option D, 400 calories plus 10 to 12 gram protein. The correct option is option B, 500 calories plus 12 to 15 gram protein. Identify the following image. Option A, Kawasaki disease. Option B, measles. Option C, pertussis. Option D, mumps. The correct option is option A, Kawasaki disease. The priority nursing assessment in the first 24 hours after admission of the patient with thrombotic cerebrovascular accident, CVA is option A, pupil size and pupillary response, option B, cholesterol level, option C, echocardiogram, option D, bowel sound. The correct option is option A, pupil size and pupillary response. A 45 years old male patient presents to the outpatient department with symptoms suggestive of active pulmonary tuberculosis, including persistent cough, weight loss, and night sweats. As part of the diagnostic workup, the physician orders a Montex test using 0.1 ml of purified protein derivative (PPD) to be administered in the left forearm. The nurse preparing to administer the test recall the correct route of administration for PPD. Which route should be used to administer the Montex test? Option A, intradermally. Option B, subcutaneously. Option C, intramuscularly. Option D, intravenously. The correct option is option A, intradermally. A nurse is monitoring a 6-month-old infant undergoing a minor surgical procedure. The baby appears drowsy but remains conscious and is able to remain airway reflexes without assistance. This condition is referred to as conscious sedation. Which type of anesthesia is most likely being administered? Option A, general anesthesia. Option B, moderate sedation. Option C, deep sedation. Option D, local infiltration anesthesia. The correct option is option B, moderate sedation. During delivery, a newborn's anterior shoulder becomes impacted behind the maternal pubic symphysis, shoulder dystocia. What is the first maneuver that should be attempted? Option A, suprapubic pressure. Option B, Mac-Roberts maneuver. Option C, Wood screw maneuver. Option D, Javanelli maneuver. The correct option is option B, Mac-Roberts maneuver. A 35 years old male is brought to the emergency department after a road traffic accident. He is unconscious and the nurse suspects increased intracranial pressure (ICP). Which of the following finds confirms the pressure of Cushing stairs? Option A, elevated blood pressure, tachycardia, trachypnea. Option B, lowered blood pressure, bradycardia, irregular respiration. Option C, elevated blood pressure, bradycardia, bradypnea. Option D, lowered blood pressure, bradycardia, normal breathing. The correct option is option C, elevated blood pressure, bradycardia, bradypnea. A 24 years old female is brought to the emergency department with complaints of lightheadedness, tingling in fingers, and rapid breathing after a panic attack. Her atrial blood gas (ABG) results are as pH 7.55, PaCO2 25 mmHg, and ACO3 22 milliequivalent per liter. What is the most likely acid-base disturbance? Option A, metabolic alkalosis, uncompensated. Option B, respiratory alkalosis, uncompensated. Option C, respiratory alkalosis, partially compensated. Option B, metabolic acidosis, compensated. The correct option is option B, respiratory alkalosis, uncompensated. Thank you for watching. Please like and subscribe.